We are built to survive, even through horrible things. There's so much stress out there, continuous distraction. We don't need fancy applications. We need our breath.
Dr. Sarah Boss is the clinical director and a psychiatrist at The Balance. She blends psychiatry with cutting-edge neuromodulation to transform mental health and addiction recovery.
The brain has a tendency to always want the known. We repeat the same patterns. A lot of people have the same kind of relationships, even if they don't work, but it's not essentially the best thing for me.
In this episode, she reveals how The Balance uses innovative therapies and holistic care to transform lives from the inside out.
All these things we can do to really help people with even severe mental issues. The benefits are immense, there's 100% only benefits. What's really needed for all of us is to
Sarah, happy to have the chance to talking to you. When we're reading your resumes, you have so many disciplines, and also you are a psychiatrist and you are the lead of clinic here. Could you tell us what got you into the world of healthcare and all of this?
I was always fascinated by it. I always thought already as a child that there are things out there, space, for example, the universe, and also our brain, our mind, that we just endlessly can explore, at least in our lifetime. There is so much to it. It will never end. And that was fascinating to me, to be able to understand and explore. And now, with time, I noticed that not just our brain is endless in our nervous system, but also each person is like another world, another universe within itself, and that's so beautiful to look at it that way, I find.
From where you envisioned what balance will be from the very beginning stage until today, did you see the changes?
Absolutely. I think we're getting better and better in what we're doing, obviously, with time, with having a better team, with having found the right people, and more variety also of what we can offer now.
What are the upcoming things make you feel excited about?
Several directions where psychiatry, for example, is going into more and more to go away from just medication, for example, because a lot of patients nowadays ask for it more and more, that they want other options, or maybe they've tried medication already, or maybe they don't want to try it in the first place. In many patients, it's also not helpful by itself. So what we see is one big area is all the technology-based treatments. I would summarize it maybe as neuromodulation with neurofeedback, TDCS, TMS, all these things we can do evidence-based in a safe way now to really help people with even severe mental issues without even needing medication, or even for patients that have resistant disorders and have not had good experiences with medication. And then another big area is everything that we call now the bottom-up approaches. I think I'm really excited about that. I feel that's so beautiful and so important that we know now how important our nervous system is, how much it influences us, that just talking and just thinking is not enough. Especially for our kind of clients, what's really needed for all of us is to work with our body, work with our nervous system, work bottom up. And all these things that are sometimes called vagus stimulations or polyvagal informed therapies, I think that will be also more and more important in the future, including the safe and sound protocol, for example, and being more aware of methods like somatic experiencing, yoga, qigong, integrative therapy approaches, and also touch, like to have a little bit outlook, like how important it is to have a massage, not just because it feels good, but to be touched and to be stimulated and to be with another human being in a completely different way. That is not just cognitive.
Right, because our channel is very exciting and very deep dive into the brain, because we believe the brain and body connection is one of the fundamentals for people to making any change. And when we talk about neuromodulation, what are balance approach towards it? Like if a client walk in, did everybody need it? Do you going to map out their brain? How does that work here?
We tailor it to each client. So there are some topics where I would always recommend it. For example, sleeping disorders, ADHD, clear indication, or anxiety, also clear indication. And then also if somebody has a depression or had a stroke, also evidence-based, clear indication. And everything else, that I would say depending on if the client had already treatment experience before and maybe comes with, yeah, I've tried so many things and I'm not getting better, then I would also try it, even if it's evidence level B, for example, probably efficient, but that's what they're here for. And we always combine it with other methods, of course. I would say we're quite open to it. We want to use it if it makes sense, like everything. And another big area is, of course, the whole field of microbiome, brain-gut axis, you know, all the integrative medicine or functional medicine, how some call it, that I think is also regarding the outlook an important topic, but that already is quite common knowledge, I think, in most treatment centers, how important the diet is.
If you break down our everyday healthcare into few pillars that people need to focus on,
Yes.
because right now they have
Yes.
so many information everywhere.
Absolutely. Yeah, it's hard to find the way. I think, as always, we should start with connecting to ourselves again. You know, usually there's so much stress out there. The smartphone is a huge problem for all of us. The continuous distraction, all the demands, and we should all try to first connect to ourselves again, to get in touch again. What's going on? What are my needs? How can I meet them? You know, these are the first questions. And how big is the stress and how can I reduce it? And then everybody should find something that works. You know, it's not one fits all, but some people find yoga very beneficial, or some people might join a Qigong class, or maybe do meditation, or do a mindfulness-based stress reduction course of 8 weeks. And also reaching out to maybe other people, groups, that's always very useful. Maybe do these things in groups, also share with others. Then maybe finding, you know, the next step of help and support with a good practitioner that can guide through the next steps.
Yeah, I feel during the past few days with Balance team, I can really feel this funding yourself and funding the feelings within yourself is one of the core piece. And I have said before I came here, I'm in the stage a teeny bit irritated by a lot of things I got to do this month. But now I'm feeling very, very peaceful.
Great.
Just like,
That's really good to hear.
Yeah, I feel like at the beginning of this week, my feeling is all up to my mind. And then now it's very dropped down to another space, and I feel I function a lot more with balance.
Yeah, beautiful. You're connected again to yourself.
Yeah.
That's what we believe in, or we all should believe in. We have it inside of us. We just need sometimes help to connect again and to do it ourselves, and to feel like we are in charge and we can do it. And most of all, that we're safe.
I sometimes have this question because throughout our work and research, we'll be the chief guinea pig trying every treatment. And for many times, we are coming back, let's say, to the calmness and peacefulness. But then it's almost like when we're going back to the big cities lifestyle, whatever it is, it's easily to go back to the old habit.
Yes.
So how do we make sure we continue to be there? Because, life happens.
Absolutely, that's a really good question. We know that aftercare, how we call it, is just as important as the real treatment. Things get lost, we get overwhelmed again, life is really demanding. So we want to make sure that before somebody goes back home, there is already a good structure in place and something that works for each one. And that makes sense, and that is already organized, because once we're back home, there's so many challenges usually waiting for the people that things get lost or postponed. That would be important. So we prepare that, and we also guide through it. We call it like a transition phase. So we're there, we have check-ins and sessions also online. There's even the option that somebody goes with the client back home and assists the first days or weeks, or if it doesn't work out the way somebody expected it to be, that somebody flies in again and supports. But yes, we definitely want to prepare a lot. And we also want to prepare what we call early warning signs, to notice when I slip back into old habits. How do I notice it? And when is the earliest that I could notice it possibly? And then what do I do? Have like an emergency plan in place. Like, for example, reach out, have a session, or go to the next meditation studio, or whatever works for that person. But to prepare it well and to really have a change back home. And also involve the system. It's so important. The system could be the family, the partners, whoever is important, and include them in the sessions at least a little bit towards the end to make sure that things do change back home. Because sometimes, somebody can have great process in 4 weeks, but then he goes back and everything is the same back home because nobody changed in any way and nobody worked on their situation. So it's really important to also think about the system that is around somebody or that somebody is living in.
I think that's very beautiful for the people who have resources, but also want to ask in perspective for the people who want to be better themselves.
Yes.
They're working really hard.
Same thing.
Yes.
Same thing.
How can they design an environment to be best beneficial for them?
Like the same thing, like for example, that you would find something that works for you, let's say yoga, and really implement it in your everyday, put it in your schedule and have it as important, I always say, as brushing your teeth. Other things should be just as important, our mental health. It should never be sacrificed for something else we think we have to be doing. And I think that's really important, to give it the importance it has and to really put it in our schedule and to find something that's realistic. Because in our culture, we won't start meditating 3 hours a day. That's just not realistic to us. But we have to find something that really works.
I totally relate because I've been doing a lot of meditation, but I feel so guilty if I don't do it as long as I wish to, and then altogether say, okay, I'm not doing it. I'm not going to have 1 hour to meditate every day.
Yeah. That's why, for example, here we offer many, many different things so that people can try out things and find something that they can really relate to, and that is not such a also so hard to stick to once they're back home, and that they can really maybe join a group. That's always easier than if you're in a group and you have that motivation, extra motivation and social connection. Or have a personal trainer, going to a gym where there is somebody, can be so many different things.
We want to talk about well-being and wellness, right? Like, I think we all come through different trauma of our life. I would really doubt anyone have come to this world in one piece. Everything happened perfectly as one have expected. But why we develop, some people has a resilience towards those trauma, some people go hide and froze. So let's say if it's for a younger generation to watch our show, what are the things we can do to prevent us to go to the root of self-destructing?
Mm-hmm. I would say find the connection to ourselves again. And that is also very individual. For me, it's nature, for example. We know that nature in general, for most people, is something so beneficial. A lot of people live in the cities and they don't even connect to nature anymore, something we're actually genetically built to survive in nature. So these kind of things, I think, are essential to discharge. That's what we say. You said so well that we all accumulate trauma throughout our life, starting with our own birth. That is already always an unpleasant situation. And we accumulate it, and we need to discharge it somehow. The beauty of it is that we are built to survive. We are, even through horrible things. And I think your question is really good because there's more and more research now also on resilience. What is resilience? Why do some people cope better with things than others? And one way of seeing it is that it depends on how much we charge our nervous system, how much is piling up, how much we are exposed to, of course, as well. And there are always these two sides. First of all, we should always try to discharge, like what we just said, anything that is vagus stimulation, anything that could be positive habits in that way, nature, connecting to something that is good for you, to good relationships, but really good ones, with people that are supportive and that you can really relate to. With, of course, all the basics: healthy sleep, healthy food, healthy diet, vitamins, enough sunlight, day-night rhythm, reduce the screen times. All these things are so essential.
When some people develop the resilience pattern in their brain, and some people who don't, who just develop a freeze pattern, what happened in their brain? Will their brain, when you do a scan, different from each other?
We believe that's more in the limbic system, like here, the oldest part of our brain. That's where these survival mechanisms take place. For example, if somebody would come into this room now with machine guns, 20 people, and we would right away, we would look at each other in 1 millisecond. That's the first reaction without even thinking, social connection. And if you would see that, I would be completely relaxed and I would tell you, no, that's just for a movie, that's just actors. We would right away relax again. But if you saw in my face that I'm completely scared and in panic, you would also enter in panic. That's sympathetic activation, fight and flight. And we would consider in 1 second, can we fight those people? No, there are too many. Can we run away? No, because there is no way we can get out of here. And then we would freeze. Theoretically, most people, some might keep on fighting, but it could be an option then to freeze, which would be playing dead, which is also actually a beneficial state sometimes in those moments, because it would mean we have less blood flow, we would lose less blood if somebody would hurt us, and also we would feel less pain, so we could make it maybe until we get help. So to see it that way, I think is important, that it is a physiological, a natural reaction we have, and even reptiles have, like turtles, they only have that kind of reaction. So the shutdown per se is not a bad thing. The problem is that a lot of people, they get so often so overwhelmed that they stay in that place and that they can hardly get out of it anymore. And that's when they really need help, because that's not a state we should be in many times. We shouldn't feel so threatened that we feel like we can't fight and can't flight. We can't solve it in any way anymore, and we can only go into shutdown because we're so threatened. That's something we should actually not live through.
I feel like a lot of us could relate this tension on the back of our neck. And then I realized during the past few days when we do the feeling of the body experience, which called somatic experience, when there have something irritate me, I first feel it here. And I feel like a numbness, like I don't care, I'm not scared of it. But I don't realize that's carry a fear in me all the time. And I'm normalized it. I think that's how I always feel. And I don't
you got used to it.
So speak to feel your body and feel within yourself. That's the question, right? When the people, they never feel it, what it feel like to be in oneself. And then it's almost like it's just words value. Everybody know I should feel more, but what does that mean to feel more? How can a person to really feel more? Like that's the thing.
Exactly. That's a really good question also, because it's not even about feeling, because feelings, I think a lot of people have even strong feelings, maybe even anger or fear or sadness. There are a lot of intense feelings out there. But what's important are also to distinguish between sensations in our body, like body sensations and feelings. They're different things. And a lot of people, I think, are, like you said, really, really used to being completely dissociated, like from the head to the body. And it's really hard in the beginning to connect again, no doubt, for everybody. And it's something we can practice, really carefully practice, like everything else in life. And a lot of people, I think, also unconsciously maybe are scared of connecting to the inner world because they did an immense job in holding it together and keeping on going in their lives and building up walls maybe, and not let the trauma come out. And that's how they survived, and that's how they were successful. And that's a coping strategy that was important, because that's what they made them somehow successful to keep on going in their life. But then the day might come where the costs are too high, and then they come into treatment. And then what happens, or that can also be, in a different setting, but then what happens is that we should really slowly and gradually and carefully deal with this. Like we say in chemistry, titration, we would only do 1 drop and then let the nervous system integrate it. And just a little bit. And then it's also not scary anymore, because we don't want to feel overwhelmed anymore, because everything that's kept in there is having been overwhelmed. So what we want to do is really gradually, really carefully discharge all these things and get back into connection and sensations with our own body, and then relate again also to being able to trust, for example, the famous gut feeling. A lot of people nowadays say that I actually, when I met that other person, at the first moment I noticed, I shouldn't relate.
Why was that?
But then they start thinking and ignore it, and then they might end up in a toxic relationship. But if they think about it, one moment they had that true feeling, sensation, that no, back up, get some distance. And that's a beautiful thing that happens with time, that we can trust again our sensations and the wisdom in our nervous system, because that's immense. Actually, it's much higher and much bigger than our brain knowledge, so to say.
I can relate to that, because the reason at the beginning stage I don't want to drop into my feeling is, first of all, my brain functioned well. And I was like, okay, since it's already working, I feel our brain always trying to save energy for us so that we can live longer, so that the brain automatically go into the mode, like, at least it wouldn't go worse than this. But if I do something uncomfort,
yes,
it might be not working. I might get no motivation to work at all. I might just want to enjoy.
Yeah.
So could you tell us what are the benefits if we drop to our heart and more relate to ourselves in health and in work? Can that make us working even better?
Yes, 100%. The benefits are immense. There's 100% only benefits. And the brain, you just said it really well. The brain has a tendency, that's naturally born with it, to always want the known, even if the known is not the best thing for us. We repeat the same patterns. A lot of people have the same kind of relationships, even if they don't work. Then the next partner will be similar. And the brain doesn't want the unknown, because it wants to protect us from learning all over every single day. So that's like something we need to be aware of. It's normal. It's not just me. It's just normal. But it's not essentially the best thing for me. And if we connect again to our nervous system, we're more in a natural, balanced state. So we don't have to use so much energy anymore to dissociate, to keep it together, to develop symptoms like sleeping disorders, like anxiety, maybe digestive problems, or maybe problems relating to other people. Social connection have so much to do here with the vagus nerve, that is here actually and not here. Like here we feel safe with somebody or not. And if we manage to connect again, and we have to, because we're mammals, we're not robots, we're developed animals. And if we can connect again to our nervous system, to our wholeness, then we have so much more possibilities to regulate ourselves and not have all those symptoms in the way anymore, and all that energy we need every day to cope and to have all these strategies in place and these defense mechanisms. And one thing from basic physiology, we know now that the vagus nerve, the biggest nerve that is connecting the body and the organs with the brain, we know that at least 80% of the information, some say 90%, goes from the body to the brain. And only 10%, or some say 20%, goes top down, which means it's just a fact. It's not something we made up. It's a fact that in evolution we're built that way, that this was much more important, that these signals go up to the brain. And this gives us also an immense opportunity to influence. If we are using our body to regulate ourselves again, to connect, to breathe, these simple things that we always have at hand. We don't need fancy applications or watches or whatever. We need our breath. The breath is so much more powerful, and we have it always at every moment of our life. If we use this, we have this 80 to 90% of influence to the brain. But we are so overthinking, of course, that the brain is putting a brake on. It is almost keeping us in the beginning to do that, also to protect us maybe in a way. But that's the beauty of it. If we can let go of that control, it will automatically, completely natural, work its way. And that's the beauty. It's so natural because it always feels good to connect something, that is our nature, that is just our setup also.
I love what you say. To second that, the best way I heard is also they said our brain or our storytelling self, they are the maintenance, right? If we don't know, we probably just go out, get crashed by a car. So they do have some use to some basic things, but then they're supposed to be the maid and the maintenance of our life, but then we're supposed to experience everything else. But then brain now became the master and they rules everything, which is so wrong, but we feel safe that way.
Exactly. And we see that a lot here as well, because our clients are usually a lot of them are very intelligent, very successful. And I think the more we use our brain also, the harder it gets in the beginning to control it, to balance it out. It's like having a racing horse. We need to be able to also give it calm times and take care of it. We can't always just be on 100% speed. So we have to learn how to control that overactive mind. That's just essential.
One last question for the audience, if they can only take one big takeaway of balance philosophy of how do you master your mind, what will be that tip?
I would say to slow down, to really experience again every session or every moment of our life, every little thing, every leaf of green. We can call that mindfulness or whatever we want to call it, but to slow down. This workout so fast and the phone is so dangerous. So we really have to be aware of that and remind ourselves every single day to slow down and make experiences and connection to ourselves even possible.
Thank you, Sarah. I feel I learned a lot from this conversation.
Thank you. It was a pleasure.
Thank you for watching the HumanWare Project. To help us to getting more amazing content out there, please subscribe. It means a lot and it will help us to grow. And let's go on this journey together.